Healthcare Disparities and Acute Mesenteric Ischemia, an analysis of factors that lead to mortality. Maria Pesantes, Azucena de Real, Asif Samir, Chelsea Chang. University of Texas Rio Grande Valley Internal Medicine Residence. Introduction. Acute mesenteric ischemia is characterized by an interruption of the splanchnic circulation, leading to insufficient oxygen delivery to visceral organs. Despite of being uncommon, acute mesenteric ischemia remains a highly morbid condition, with reported mortality rates ranging from 30 to 90%. High mortality rate is mainly attributed to delay in diagnosis and treatment. Factors affecting mortality have not been studied extensively. Consensus has not been achieved. However, it is well established that duration of ischemia is one of the most important factors influencing prognosis. A delay in initial diagnosis and treatment, which may be the result of lack of access to healthcare, may result in a poor outcome. Due to the economic burden, individuals that are uninsured may be more vulnerable to the complications associated with acute mesenteric ischemia. Our study analyzed the acute mesenteric ischemia outcomes in Hidalgo County, where the reported poverty rate is 3 times higher than the United States average. 30% of the population does not have any type of health insurance, and almost half of the remaining 70% are Medicaid users. The aim of our study is to determine if socioeconomic factors have an impact on mortality. Methods. We reviewed electronic medical records and extracted data using codes for acute mesenteric ischemia diagnosis from July 31st, 2014 to July 31st, 2019 in a private hospital. All electronic medical records obtained were confirmed as acute mesenteric ischemia using the current gold standard for diagnosis: CT abdomen, mesenteric angiography, or exploratory laparotomy. Results: 29 cases were confirmed as acute mesenteric ischemia in 5 years, and mortality before discharge was 38% in our sample. 83% of patients were 65 or older. 9 out of the 11 patients that died were 65 years and older. There was no significant difference in mortality between the male and female group. 8 out of the 11 patients that died were Hispanics. 14% were uninsured, while 72% had Medicaid alone or combined. 83% of patients that survived had a primary care physician. Conclusion: mortality in our cohort was congruent with numbers reported in the literature. Age and access to primary care were the only 2 statistically significant factors associated with mortality. The patients that were uninsured survived. Probably this is because of the small sample size. Overall, our study showed that lack of access to primary care, which is related to healthcare disparities, may play a role in mortality associated with acute mesenteric ischemia. Although insurance was not statistically significant, access to primary care is a relevant socioeconomic factor associated with mortality. Primary care physicians might play a role in prompt diagnosis, as this is the most important prognostic factor.